If you had a ticking time bomb inside your chest, you would want to know right away, right? High blood pressure is exactly that bomb. It is called the silent killer for a very good reason. It does not announce itself to you. You feel completely normal right up until the heart attack, the stroke, or the kidney failure that you never saw coming. Here is the absolute hard truth. After 50, controlling it gets much harder. Not because you lack willpower, but because your biology shifts. Your arteries naturally stiffen. But what if the fix was not just a pharmacy pill? What if the real solution was already sitting right there on your dinner plate? The good news is that your daily diet has a measurable and clinically documented power over your blood pressure. The NIH developed the DASH diet specifically to study this. The clinical trials showed amazing reductions that are actually comparable to many of the common first-line medical treatments. Today, we are covering 5 specific foods. You might know they are healthy, but do you know that using mouthwash can completely destroy the blood pressure benefits of eating fresh root beets? Or that garlic requires a very specific cutting technique to release its full vascular power, and that blueberries target the exact same physiological mechanisms as an ACE inhibitor medication? Most people have no idea what that acronym actually means. We will explain exactly what this mysterious ACE enzyme is and how it naturally constricts your blood vessels as you start getting older. We are not just giving you a basic grocery list today. We are going to break down the real biochemistry behind each of these 5 foods. Let us dive straight into the science and protect you. And to understand why those 5 foods work, you first need to understand what hypertension is quietly doing to your body. Because the mechanism behind each food maps directly to the damage. Silent killer is one of those medical phrases that gets overused. With high blood pressure, it actually earns the name. It doesn't hurt. It doesn't announce itself. In many cases, people walk around for years, sometimes decades, with elevated pressure and feel completely normal. Until they don't, until a heart attack, a stroke, kidney function that quietly erodes and doesn't come back. Here's what doesn't get discussed enough. After 50, controlling blood pressure gets harder, not because of willpower, but because of real physiology. Arteries naturally stiffen. The kidneys lose efficiency processing sodium. The hormonal systems that regulate vascular tone shift. That's not weakness. That's biology. The good news, and there is genuine good news, is that diet has measurable power over blood pressure. Not magically, not overnight, but in a way that's been clinically documented. The DASH diet, Dietary Approaches to Stop Hypertension, was developed by the NIH specifically to study this. The original clinical trial, published in the New England Journal of Medicine in 1997, showed that dietary changes based on the DASH approach reduced systolic blood pressure, the top number, by 8 to 14 points in people with hypertension. For context, many first-line blood pressure medications lower it by 10 to 15 points. That is not a marginal effect. Today, we're covering 5 specific foods, and more importantly, the mechanism behind each one, not a list of eat this because it's healthy. 5 foods with real identifiable biochemistry. Think of your circulatory system like a plumbing system. A pump, your heart, pipes, your blood vessels. Blood pressure is simply the force your blood exerts against those vessel walls. When arteries stiffen, which happens naturally after 50, the heart has to work harder to push the same volume of blood through. It's like forcing water through a rigid, hardened hose. Pressure on the walls goes up. And over time, that sustained force damages the vessels, the heart, and the kidneys. Food can influence this process 3 ways. By boosting production of nitric oxide, a molecule that signals blood vessels to relax and widen. By changing how the kidneys handle sodium, the main driver of water retention and elevated blood volume. And by reducing inflammation in the vessel walls, an underappreciated cause of arterial stiffness. With that in mind, here are the 5 foods. Food 1. Beets. Beets are one of the most concentrated dietary sources of inorganic nitrate you can get from food. Here's how the pathway works. When you chew a beet, bacteria naturally living in your mouth convert some of that nitrate to nitrite. Once the nitrite reaches your bloodstream, enzymes finish the conversion to nitric oxide, the vasodilating molecule we just covered. Nitric oxide signals the smooth muscle cells surrounding blood vessels to relax, wider vessels, less resistance, lower pressure. Research published in the journal Hypertension, along with separate findings in the British Journal of Nutrition, documented average systolic reductions of 4 to 8 points with regular beet juice consumption in people with hypertension. Here's a practical detail most people never hear. This effect depends partly on oral bacteria. Antibacterial mouthwashes used right before eating beets can block the nitrate-to-nitrite conversion and undercut the benefit entirely. That's not a quirk. That's the physiology working exactly as the research describes. Food 2. Garlic. Garlic is one of the most well-studied foods for cardiovascular health, and its mechanism is especially relevant for anyone managing blood pressure. When you crush or chew a garlic clove, you activate an enzyme that converts a compound into a lysine, the source of that sharp, distinctive smell. The sulfur compounds that follow do 2 things. First, they inhibit ACE, angiotensin-converting enzyme, which normally helps constrict blood vessels. This is the same mechanism targeted by an entire class of blood pressure medications called ACE inhibitors. Second, they stimulate hydrogen sulfide production in the smooth muscle cells of blood vessels, producing direct vasodilation. A 2016 meta-analysis in the journal Maturitas pooled results from multiple randomized controlled trials. It found that garlic reduced systolic blood pressure by an average of 8.7 points and diastolic by 6.1 points in people with confirmed hypertension. Practical note: crush or finely chop the garlic and let it sit for 10 minutes before applying heat. That window allows full allicin formation. Raw garlic preserves the most active compounds. Adding it near the end of cooking also works. Prolonged high-heat cooking reduces the effect. Food 3. Blueberries and berries. Blueberries, blackberries, and strawberries are loaded with anthocyanins, the flavonoid family behind those deep, rich colors. Anthocyanins work primarily on the endothelium, the thin layer of cells lining the inside of blood vessels. They stimulate nitric oxide production, reduce the oxidative stress that drives arterial stiffness, and newer research suggests they also partially inhibit ACE activity, the same target as garlic. A 2015 study in the Journal of the Academy of Nutrition and Dietetics followed postmenopausal women with stage 1 hypertension for 8 weeks. The group eating roughly a cup of blueberries a day saw average reductions of 5 points systolic and 6 points diastolic compared to the control group. And in the long-running Nurses' Health study, women with the highest anthocyanin intake had a 12% lower risk of developing hypertension over time compared to those with the lowest intake. The next 2 foods have something especially relevant for people over 50, and it ties directly to why blood pressure gets harder to manage in exactly this stage of life. Food 4. Dark leafy greens, spinach, kale, arugula. The central mechanism here is potassium, and the imbalance most Americans are living with between potassium and sodium. Sodium and potassium work in opposition inside your kidneys. Sodium signals the kidneys to hold water, raising blood volume and pressure. Potassium signals the kidneys to flush sodium out through urine. Less retained sodium, lower blood volume, lower pressure. It's a direct, well-established pathway. Most Americans take in between 3,400 and 3,600 milligrams of sodium per day, above recommended levels, while getting less than half the potassium they actually need. The American Heart Association recommends 3,500 to 4,700 milligrams of potassium daily for adults with hypertension. 1 cup of cooked spinach delivers roughly 840 milligrams. A serving of cooked kale, around 630. These greens also provide magnesium, which helps smooth muscle cells and blood vessels relax, and they contain the same dietary nitrates found in beets. In that original DASH trial, a diet rich in dark leafy greens was associated with an 11-point drop in systolic blood pressure and a 5.5-point drop in diastolic, with no additional medication. One important flag: if you're on medications that raise potassium levels, ACE inhibitors, ARBs, or potassium-sparing diuretics, talk to your doctor before significantly increasing your intake of high-potassium vegetables. The ramp-up should be gradual and may need lab monitoring. Food 5. Fatty fish, salmon, sardines, mackerel. Fatty fish are the most concentrated dietary source of long-chain omega-3s, specifically EPA and DHA, the forms your body uses most directly. These fatty acids work on blood pressure through multiple pathways. They reduce production of inflammatory compounds that drive vascular stiffness and constriction. They improve endothelial function. And there's evidence they modestly lower resting heart rate, which by itself reduces the overall workload on the heart and the resulting pressure. A 2014 meta-analysis in the American Journal of Clinical Nutrition pooled 70 randomized controlled trials. It found that EPA and DHA at doses above 3 grams per day reduced systolic blood pressure by 1.5 to 2.5 points, with stronger effects in people who already had established hypertension. The American Heart Association recommends at least 2 servings of fatty fish per week as part of a heart protective diet. On canned sardines, they're clinically equivalent to fresh fish, more affordable, and the soft edible bones add a meaningful source of calcium on top of the omega-3s. On fish oil capsules, the AHA's own scientific statement on omega-3 fatty acids makes clear that the blood pressure evidence is stronger with whole fish than with isolated supplements. 5 foods, 5 distinct mechanisms: nitric oxide production, ACE inhibition, endothelial function, the kidneys' potassium-sodium balance, and vascular inflammation reduction. So what does this look like day to day? The goal isn't to add all 5 foods at once. That's a reliable path to dropping the whole thing within 2 weeks. Gradual changes that stick. That's the point. Beets. 2 to 3 times a week. Plain beet juice, no added sugar, about 1 cup per serving. Roasted or cooked beets in salads also work. The effects documented in studies appear with 2 to 4 weeks of consistent use. Don't expect your numbers to shift the next morning. Garlic. At least 4 meals a week, 1 to 2 cloves per meal, the dose used in the main studies. Crush or chop it, let it rest 10 minutes before heat. Raw is best. Light cooking is fine. Long high-heat cooking reduces the effect. Berries. 1 cup a day. Frozen blueberries have equivalent bioactive compounds to fresh and are easier on the grocery budget. Breakfast, smoothies, plain Greek yogurt. Whatever makes daily consistency realistic. The benefits in the studies came from 6 to 8 weeks of daily consumption. Dark leafy greens, 2 to 3 servings a day. 1 cup of cooked spinach or kale per serving. The goal is to approach the AHA's recommendation of 3,500 milligrams of daily potassium, a target the average American diet falls well short of. Fatty fish, 2 servings a week. Salmon, sardines, mackerel, or herring. 1 serving is roughly 3.5 to 5 ounces. Canned sardines in water or olive oil are a solid, affordable option. And as noted, the evidence for blood pressure reduction is stronger with whole fish than with capsules. Before we wrap up, there's something that can't be left out. It may be the most important part of this video. There are situations where diet alone isn't enough, and there are medication interactions you need to know before changing anything in your routine. This needs to be said plainly. Diet complements medical treatment, so it does not replace it. If you've been diagnosed with hypertension and you're on medication, nothing in this video is a reason to adjust or stop any prescription without talking to your doctor first. That's not a legal disclaimer, it's clinical guidance. Garlic and blood thinners. Garlic has a mild anticoagulant effect. The NIH's Office of Dietary Supplements explicitly flags interactions between garlic and warfarin, clopidogrel, and other blood thinners. If you're on any of these, tell your doctor before increasing your regular garlic intake. Potassium and potassium-retaining medications. ACE inhibitors, ARBs, and potassium-sparing diuretics can already push potassium levels higher. A sudden jump in high potassium vegetables on top of that creates a risk of hyperkalemia, too much potassium in the blood, which can affect heart rhythm. Keep any increase gradual. A quick note on grapefruit. It didn't make today's list, but it's worth flagging because it's popular in this age group. Grapefruit inhibits a liver enzyme that metabolizes several cardiovascular medications, including certain calcium channel blockers. Check with your doctor or pharmacist if you're on any of those. When to seek care right away. Systolic above 180 or diastolic above 120. That's a hypertensive crisis. Emergency room, not a phone call. High readings accompanied by a sudden severe headache, blurred vision, chest pain, or sudden shortness of breath. Readings above 150 systolic persisting for several consecutive days, even in someone already on medication. That's a signal the current treatment needs review. On-home monitoring. Measurement errors are common and frequently lead to the wrong conclusions. The AHA is clear. Measure sitting, back supported, arm at heart level after 5 minutes of rest, not after coffee, exercise, or a cigarette. Take 2 readings per session with 1 to 2 minutes between them, and bring those records to your next appointment. Some forms of hypertension have underlying causes: untreated sleep apnea, chronic kidney disease, hormonal disorders. Diet helps, but it doesn't touch the root cause. If your doctor has prescribed medication, it's because the risk-benefit picture makes sense for your specific situation. Diet and medication aren't competing tools. They work together. The short version. Beets. Dietary nitrate converted to nitric oxide, relaxing vessel walls. Garlic. Sulfur compounds that inhibit ACE and drive direct vasodilation. Blueberries. Anthocyanins that improve endothelial function and reduce vascular inflammation. Dark leafy greens. Potassium that counterbalances sodium in the kidneys, lowering blood volume. Fatty fish. Omega-3s that reduce vascular inflammation and support endothelial function. None of these is a cure. None will stop a hypertensive crisis. But built consistently into a balanced diet, they have measurable clinical impact, backed by real research, not promises. Blood pressure is one of the most diet-responsive health markers after 50. That's genuinely good news. What's on your plate is a real tool, not magic, but real. If this kind of content is useful to you, consider subscribing, not for generic health tips, for evidence-based information made for adults over 50 who want to understand the why, not just the what. Every source is in the description. Everything here is verifiable, grounded in science, never built on miracle claims. Thanks for watching. See you in the next one.